Hi, everyone. My name is Kevin O'Reilly. I am the Right to Repair advocate with US PIRG, and I want to thank you all for joining and send a special thanks to Senator Wyden's staff and our expert biomedical repair technicians, also known as biomeds, for being with us today. A quick logistical note, your camera and microphone are turned off, so you can ask questions through the Q&A and chat feature. We will be taking a few questions after our experts speak, but additional questions afterwards can be directed to nproctor@pirg.org. Last month, US PIRG released a report showing that 91.8% of the 222 biomeds surveyed had been denied access to service materials like manuals, parts, and service keys for critical equipment such as ventilators. Nearly half had been denied access to these service materials since the coronavirus first swept through the country in March. Frankly, that's unacceptable. There is no reason we should tolerate manufacturers putting their own proprietary concerns over patient safety, especially during the pandemic. At US PIRG, we've been working with hundreds of biomeds across the country to advocate for their ability to fix the equipment in their hospitals. Our work has led to some ventilator manufacturers releasing manuals and training modules, but that's simply not enough. Manufacturers of imaging equipment, for example, continue their clampdown on service materials needed to fix the equipment that they make. And that's why this bill is so important. With the introduction of the Critical Medical Infrastructure Right to Repair Act, Senator Wyden has put forth a common sense way for the Senate to help hospitals in their time of need, and a terrific first step towards a long-term solution to manufacturer-imposed barriers to repair. So with that, I'm gonna hand things over to Alir Kuloli, who is the president of the American College of Clinical Engineering.
Thank you, Kevin. And thank you for this opportunity. I just want to thank everybody for all the efforts in this, and especially Senator Ron Wyden for introducing this bill. As we all know, COVID-19 is putting incredible stress on the U.S. medical system, including the work of hospital clinics and biomedical engineers, as well as repair technicians. These are very highly trained professionals who can really repair anything and anytime if you give them the right tools. They can walk into a patient room and fix a ventilator, anesthesia machine, or a patient monitor at a moment's notice. However, in some cases, manufacturers restrict access to training and service manuals and parts that these professionals need in order to provide these critical services for our patients and our physicians. This bill, which is being introduced by Senator Wyden, is a significant step in removing these unnecessary barriers to repairing essential and critical medical equipment. The right to repair is essential not only during this pandemic or not only during a pandemic, but especially during a pandemic or an emergency. What we want to see is freedom to repair equipment that we own, freedom to training to these devices and equipment that we own, so that when the next emergency or a pandemic hits, we are not behind the 8 ball, but we will have staff that are already trained on these critical devices. We'll have service manuals available and have parts on hand to replace faulty parts and make devices available for use immediately. So with that, American College of Clinical Engineers fully supports this bill and the right to repair medical equipment for our engineers and our technicians. Thank you. Thank you very much.
Great. Thank you, Alir. With that, I'm going to hand things over to Senator Wyden. Thank you so much for joining us today, and we'd love to hear a little bit more about the bill.
Kevin, thank you, and thanks to PIRG for all the leadership, not just on this, but on so many consumer issues right now, where it really is again and again the question, standing up for the consumer, standing up for those who need, particularly in the middle of a pandemic, essential health care. And again, we're up against these big lobbyists and special interests who constantly trot out these tired, rehashed arguments about why there shouldn't be any choice and there shouldn't be any competition, and the consumer, frankly, shouldn't even be able to control what they own. I mean, that is how bizarre this really is. So I think people understand what we're talking about. Hospitals and health clinics right now being under extraordinary stress given an unprecedented pandemic. We've read the stories about doctors and nurses and providers who grapple with shortages of critical equipment. I hear about it at home. In Oregon, the Finance Committee held a hearing, and we heard about one home health staffer was talking about how disinfectant materials had to be cut up into little pieces in order to be able to retain them. So that's what we're dealing with. Increased wear and tear due to overuse, increased repair and maintenance for dialysis machines, x-rays, and ventilators. And this comes at a time when there's a huge increase in demand for repair technicians. Social distancing guidelines have made traveling to and from hospitals, especially for those in rural areas, not just difficult, but can often be a logistical kind of nightmare. Many hospitals have on-site independent technicians, but the companies that make medical equipment often use anti-consumer restrictive licensing agreements and copyright law, if you can believe it, in order to prevent hospitals from diagnosing and fixing their own equipment. Rather than fixing the broken ventilator technicians are spending hours on the phone pleading for parts. They're kind of praying they're going to get manuals and passwords. And according to the study that you all, Kevin, put out at PIRG earlier this year, about a third of medical equipment sits idle in hospitals waiting on getting a repair. That is a jaw-dropping number, all of that equipment waiting on repair. So with life-saving equipment basically gathering dust in a closet, patients have to wait for something, and I'll quote here, called a manufacturer authorized technician. Now that is kind of fancy legal boilerplate for saying a technician who's willing and able to pay something like $10,000 a year to get access to the manuals. It's basically a shakedown kind of effort in order to take advantage of repair techs and hospitals. It's a racket. Experts are warning that repair delays could be fatal for patients, especially, as I mentioned, in remote and underserved parts of the country. Now, in normal times, the device manufacturers are essentially squeezing the sick to crank up profits. But blocking repairs now, during a pandemic, there are a lot of short-sighted laws on the federal statute books. But I really think this one just about takes the cake. Vice reported that some repair technicians have resorted to buying what amounts to hacking tools from Poland in order to fix ventilators. Studies show that an overwhelming majority of repair technicians have been blocked from making critical repairs as a result of manufacturer restrictions. And newer devices have more advanced technologies to prevent people who aren't part of these shakedown schemes from repairing them. So, given how wrong all of this is, I said we ought to write some legislation to unravel the status quo. My bill, the Critical Medical Infrastructure Right to Repair Act, would remove the red tape preventing needed repairs during the COVID-19 crisis. The goal is simple: allow trained repair technicians to more easily access information and tools required to complete maintenance and repair of medical devices. It is a narrow, it is a temporary fix for an urgent problem, and nobody can say that it's going to throw out copyright or patent contract laws. It's basically modest tweaks to them. And I believe, and this really gets to the heart of this debate, intellectual property law should not be preventing the critically needed repair of medical equipment in the middle of this unprecedented crisis. And just another couple of concerns that have come up in discussing this. This bill has nothing to do with patient safety. The bill is simply removing red tape, and nothing in this bill exempts a healthcare provider or a technician from meeting the safety standards as set out by the FDA and other relevant agencies. In fact, in 2018, the Food and Drug Administration released a report finding third-party entities to repair this essential equipment is critical to the US healthcare system. That's what the FDA found just recently. By providing this information to well-trained professionals, this bill would allow more Americans to receive high quality care at a lower cost during a time when they're already up to their eyeballs with medical costs and bills pouring in as a result of the pandemic. So my view is this is urgent business. It's common sense. I would frankly argue that the right to repair, in my view, should not be limited just to a pandemic. There's no reason you ought to have to keep paying just to operate equipment you already own pretty much, indefinitely. In 2015, I supported an exemption copyright law to let drivers and gearheads tinker with and fix vehicles. In 2013, I proposed that cell phone unlocking should be allowed to let folks move between the various carriers. So there's a lot to do to protect, consumer rights to the things they already own. I will tell you, it's a pleasure to work with PIRG. I go back to the days when I was director of the Gray Panthers. Before I came into public service, I had a full head of hair and rugged good looks, and we always looked for coalitions between the Gray Panthers and PIRG. So it's great to have a chance to work with you on this. I think we all understand that it's going to be a big lift, a heavy lift, considering the sway that the copyright lobby has here in DC. But everybody ought to be able to say that today, in the middle of the worst public health calamity anyone has seen, arbitrary contract rules shouldn't be what prevents Americans from being able to access a ventilator or to survive a case of COVID. So big thanks to Kevin and the PIRG for all your good work on this. Obviously, what we're going to be doing is taking on some really powerful lobbies. I understand that. It's a crowd that knows something about taking on powerful lobbies. But at the end of the day, let's get the message out from sea to shining sea that everybody should have a right to repair what they own during a pandemic. I don't think that's too complicated a concept to get across. And I just look forward to working with all of you. And we got a vote coming up here in a few minutes, so I'm going to have to get out the door. But we want you to know we'll be working really closely with you, and our staff and I are available as we kind of go forward on it. And as the case always is with legislation, if people have ideas for refining the concept and the like. But right to repair is not a complicated idea. So we're going to push really hard to make this happen. Okay, everybody?
Great.
Thanks.
Thank you so much, Senator Wyden. Thank you for your leadership.
Thank you.
Great. Well, with that, I'm going to pass it over. One of the things that Senator Wyden talked about was the long delays that can happen as a result of the status quo. So I'm going to hand things over to Letitia Reynolds, who is the president of the Colorado Association of Biomedical Equipment Technicians, but also is a ventilator specialist. So Letitia, take it away.
Hi, no, I thank you so much. I think this is a great first step in the Right to Repair Act. Yes, it's even more critical during this COVID-19 pandemic, but this is an issue that we face all the time. I've seen it. I work on a variety of ventilators in the state of Colorado, and there's certain manufacturers that say, hey, if you're not trained, you can't work on them. And it's either you're waiting for a field service technician to come in or you're sending it out, causing those delays. Why we had those delays before the pandemic, with the pandemic and due to people being out because of COVID or unrelated things, those delays have gotten even longer. And it just, not having that vent could potentially mean a life or death of not having that to treat the patient. So this is just one step. We have technicians on site that are trained. Let us have the ability or that choice where we can fix it in-house and get it back, within a day versus waiting 2 to 3 weeks.
Great. Thanks, Letitia. And then our last expert biomed is Nader Hamoud. He is a clinical engineering manager and a member of the California Medical Instrumentation Association.
Hi, thank you, Kevin, and everyone. I just want to say that the senator made my day today with his passion and his willing to move forward with this. It's amazing to see that we can have actually support to do what's right for our patients. I just want to add to what everyone has said amazingly is we are not on the other side from the manufacturers when they say they care about patient care and patient safety and we want to do the right thing. We are all seeking the same goal, which is patient care. What we are asking for is better cooperation so Letitia can do her job and save patients. We need access to the service tools. We need access to the service manuals so Alaris team can do their job. That if all the biomeds are really qualified, they just need the opportunity to be trained, get the tools, get the service manuals so we can do our job. And this is not something new. This is not something weird. It's new to the United States, but outside the United States, it's really common that service tools are a given when you own the device, when you buy the device. It's a given that you receive those information. So it's much easier for you. And one thing I want to reiterate that the Senator mentioned and Letitia mentioned, dealing with this equipment, our fight with the right to repair, because it is a life or death issue. It's not something that we just like to take on more work or we need to take work away from the manufacturers. It's a life or death issue. We need to be able to take care of our patients. We need to be able to help our patients. Our ultimate goal when the manufacturers say their goal is patient safety, we are on the same page. We're not on different sides. Please help us, cooperate with us, share with us the information, and the Senator's bill will definitely be a great step forward, and hopefully this will make our future being able to support our patients much better. And thank you everyone again.
Thanks, Nader. So with that, we will take a few questions. If you have any questions for our panelists, please drop something in the chat or using the Q&A function. Wait one more minute. Great. Mark Levy asked, where can I get a copy of the bill? I'm not sure if that is made available on the Center's website yet or where we might be able to get that, but we should be able to get you a copy, Mark. So if you just follow up with Nathan at nproctor at PIRG.org, you can go ahead. I think he should be able to provide you with a copy.
I had a question. I think it would be great to hear from the panelists, like specifically the impact of this bill. Like if you had today got access to service keys and parts and service information, what are some of the really concrete things that would change in the way you do your work?
I can start to answer that, and I'm sure Letitia and Nader can give a lot of input. So as I said before, there is a little bit of a lag, I think, that we're going to see here because a lot of our technicians are not trained on some of these devices. So there's going to be some time to, for them to get trained. It's going to take some time for them to get acquainted, to a lot of these things that they need to learn, in order to safely repair devices. There's going to be some time that it's going to take some time for us to get the parts that we need. So, there's going to be a little, I see this taking a little bit of time. That's why I wish this bill would apply all the time, not just during a pandemic, because like I said, we are a little bit behind the 8 ball here. However, once they get the training and the parts and the service manuals that they need, first of all, patient care will be safer because we'll be able to repair equipment, to fix equipment right on the spot. Will be cheaper because we can do things cheaper in the hospital. We don't need to send things out, pay for shipping. We don't need to pay a premium for for a lot of these repairs that are going out. It'll be also cheaper because all these factors, the fact that we can fix it right on the spot, we don't have to buy another device. In many cases, we buy spare ventilators, spare machines in order to substitute these devices that we send out for repair because we cannot repair them. So we no longer have to buy all of these devices because we'll be able to repair things on the spot or repair them, same day, the next day, instead of sending them out. So I see this, not only as, making patient care safer, but it'll make it faster, deliver care faster and cheaper. These are the things that I see that this bill will definitely help us with.
I think,
Kevin,
oh, sorry.
sorry. Do you want to take the question before we continue?
Nader, go ahead for the moment, and we will take the next question shortly.
Okay, sorry, Leticia, I didn't mean to interrupt.
Okay.
I'll just throw my my quick note. That's a great question, and what's going to change is the whole platform of how we do business in the clinical engineering world and how we maintain equipment. It's all going to change, and that question actually just like made me feel so happy that can this become a reality, because everything will change. We will be able to do things more efficiently. We will have way better relationship with the manufacturers. The manufacturer will be happier because they don't have to put so much effort. They don't have to run their staff thin. They don't have to worry about, is this equipment up and running? How do we look like? Are our equipment efficient enough and reliable enough? Will we be able to sell more equipment to this organization because we're not able to support it previously? Because today, if they don't support my equipment properly, my next equipment, it's not going to be from that manufacturer. But if I'm able to maintain my equipment and I have the support that I need from that manufacturer, even if he's a no-show, or even if they have just one person for the whole area, but me being able to do this and have his support, that will be a great achievement, a great progress. We will be great in the healthcare organizations. We will introduce huge savings for both the manufacturers and the healthcare system. And I guess the future will be super bright. Having this bill move forward and having this ability, to Larry's point and to everyone's point, this will change how clinical engineering operates in the United States. It's not just a step that, okay, give me access. It will change the whole platform, whole process of how things happen.
Great, thanks, Nader. We also wanted to answer, there's a question from Susan Decker, and Keith, I was hoping that you could speak to this. The question is, are there other sponsors, and what are the odds of this bill moving forward?
Sure. And thanks again for having Senator Wyden and holding this event. Yep, Congresswoman Yvette Clarke is the House sponsor, and we expect to gain more sponsors in the next few weeks. We had to introduce on a fairly short time frame given the August recess coming up. As far as next steps and chances of moving forward, we're right now in the process of educating other members and trying to gather support. So it's a little too soon to say on that.
Great, thanks, Keith. All right, are there any remaining questions? Well, hearing none, thank you again to our panelists, to Senator Wyden and his staff, and also those who were able to log on. We really appreciate it, and we look forward to working more with you in the future.
Thank you very much.